There are two situations. The first is if they start having those violent bouts of coughing, that really suggests whooping cough, and they should be evaluated by your pediatrician, because if they do have whooping cough, we should give them antibiotics to prevent them from transmitting to other people. And then if you know that your child has had an exposure to someone else with whooping cough, and they start to have those common cold symptoms, things like runny nose, low-grade fever, mild cough, if you can get your kid in and get them diagnosed in that early period, giving them antibiotics is actually likely to prevent them from having more severe disease later.